All right, good afternoon. We appreciate everyone joining us today, and we're very excited to have Jessica with us, who will present her expert knowledge on her topic today. This webinar is being recorded and added to the UMTRC resources for all our members around the state. Just a few quick housekeeping items before we begin. As I mentioned, we are recording today's session, and it will be available on the UMTRC's YouTube channel within 1 week once the recording is processed. If at any point during the presentation you want to ask a question, please use the Q&A function. This function is accessible by hovering your mouse over the screen. It should pop up either at the bottom or the top of your screen, just depending on which view mode you're in. And the UMTRC staff will keep an eye out for those questions and will moderate for Jessica, so she don't have to check them during her presentation. And without further ado, I'll turn it over to you, Jessica.
Thank you, and thank you everyone for joining today. All right, so as mentioned, my name is Jessica Devine. I'm a data coordinator with the Upper Midwest Telehealth Resource Center, and today I'll be talking about improving quality of life through artificial intelligence for diagnosing ovarian cancer. So the usual funding disclosure that this work is supported by a grant, but the views expressed today are solely mine and don't necessarily represent the funder. So to begin, probably a lot of us have either known people who've experienced ovarian cancer or are already familiar that even after onset of painful symptoms, many patients experience delays with getting a diagnosis. So some current gaps with diagnosing ovarian cancer can include lack of knowledge about symptom awareness. So on the slide, you'll see some that are cited in the literature as being some warning signs that might necessitate further testing. And with that testing, there's not currently one single kind of standard way to diagnose ovarian cancer. There are a couple different routes that might be pursued by the clinical team depending on a variety of factors. And so upwards of 70% of cases worldwide are diagnosed at advanced stages. And validation is still needed for biomarker exams. So there's a lot of room for opportunity with improving the methods and the timeliness for diagnosing ovarian cancer. And artificial intelligence is rapidly increasing its utilization and usefulness in clinical settings. And so these next two slides, if you've joined us before with educational materials about artificial intelligence from UMTRC, you've seen these two slides before, but I want to very quickly walk through some information about AI so that it is no longer a science fiction topic, but a tool that can be used to improve quality of life. AI builds on many of the efforts that telehealth was already making. So extending resources, reaching farther geographically, improving quality of care, and improving quality of life are goals that are shared by telehealth and artificial intelligence, and hopefully that can come together really well to combine the two efforts. So AI is quite a complex and extensive area of research and work and ongoing efforts. So I can mention that if you'd like to learn more, the UMTRC has produced webinars before. If you want a more in-depth dive, look at that. But for today's presentation, I just want to emphasize the fact that AI develops instructions for a machine to take care of tasks. It's based on extensive mathematics, and so it is very much designed by people and with the ultimate goal of improving quality of life for people. And now we'll talk about opportunities to access some of this emerging technology with AI. When AI is being developed, the FDA looks at several things for considering its use in clinical settings. The FDA will look at what is the intended use of the software in the healthcare setting? How was it developed? What kind of data was used in development? And this is important because the data that gets used for development, what the AI is tested on, and what kinds of things the AI takes into consideration as the AI learns and grows is very influential then on what the AI can do tomorrow and the week after going forward. So looking at that is very important with the review process before any artificial intelligence gets deployed in a clinical setting. FDA will also look at how is the AI performed, how is it evaluated, and who did that evaluation. So building on that consideration with the development, really looking at making sure that the intended outcomes are being achieved and that they're being achieved in a way that is equitable and is useful for the health of the intended population. Finally, the FDA will also look at the logic of the code. So for any computer scientists working on developing artificial intelligence, they have their language, so to speak, oftentimes in the sense of the actual language they're using with the computer. But they also kind of have their terms and what they're used to looking at, which can be quite different than someone who works in public health or works on the clinical side. So the FDA will look at how is this code working? What is the ultimate goal that the code is trying to solve? How does it achieve that on the software side, behind the scenes within a computer, other machine? And then that will need to be explained to the clinicians to gain trust and to be implemented. So the FDA pulls together experts who have that knowledge with the computer science side, as well as the knowledge with the clinical needs and uses to be able to bring those together and make sure that artificial intelligence, just like anything else being used in a clinical setting, is being thoroughly reviewed for safety and efficacy. So if you are a healthcare provider or have the opportunity to provide education and resources to healthcare providers, some things that you can do today with artificial intelligence, specifically with patients who are either coming in to be diagnosed with ovarian cancer or have already been diagnosed, can use artificial intelligence for a couple methods to improve that journey. And I'll also talk about some more long-term research opportunities as well. But using photos with registration can reduce time on registration, such as comparing driver's license photo to a in-person scan or other other photo to compare that and speed up that registration process to reduce wait times for patients and make the process more efficient, hopefully getting patients in and out more quickly or at least more comfortably. And also in an area that is never a fun topic to bring up, but with the area cancer care of hospices, if hospice is indicated, there are opportunities to use AI for better utilization of hospice to hopefully improve quality of life by having better timing, as well as more efficient use of resources so that patients are able to enjoy the highest quality of life possible. So artificial intelligence is currently being used to optimize when conversations about hospice are happening, to first be able to bring the topic up if indicated, as well as to have conversations about the benefits and opportunities. So both in a sense of the timeliness of bringing up the conversation, as well as having the artificial intelligence be able to compare other cases to hopefully most optimize that experience. So these are two use cases that are currently being used in many different settings with different patient populations. And so there are opportunities for this software and utilization to already be deployed. So you can seek these out today, but there are also opportunities with artificial intelligence to hopefully be able to have much better treatment options where hospice would not need to be a conversation at all. So if you are not a healthcare provider, there are also opportunities to utilize artificial intelligence today to improve outcomes for patients who have ovarian cancer. Social media, as we've probably all heard in varying amounts, is definitely driven by many aspects of artificial intelligence. And while there can be a lot of negative associations with that, there are also a lot of opportunities with that for positive outcomes. So you can use social media to raise awareness, either by sharing peer-reviewed research or sharing your own personal story if you have personal experience. And so some of the do this are, of course, you can share content, and there are certainly many opportunities to kind of optimize the algorithms in terms of what content is going to be quickly viewed by your friends or your followers or other connections, of course, depending on the social media site, to be able to share that information. So you can share information about warning signs to be aware of for being conscientious of pursuing a diagnosis of ovarian cancer if indicated, as well as opportunities to support research with ovarian cancer or opportunities to help patients. So there are a myriad of different sorts of content that you might want to share, and social media can be a very positive opportunity to really utilize the artificial intelligence behind social media to be able to share this information and increase the overall awareness and knowledge of people in your personal life, as well as people you may never even meet but can offer the information to through social media. Additionally, if applicable, participating in clinical trials can be an excellent way to contribute to research, hopefully advance the research, and find better opportunities with diagnosis and treatment. And if you are a patient or know someone who is a patient who's been diagnosed with ovarian cancer, clinical trials can also be opportunities to get access to different treatments or methods that might not otherwise be available. And so using social media and these algorithms and artificial intelligence methods that really drive our use and our interaction on the internet can be a great way to help spread some of these opportunities immediately. Speaking more in terms of research and kind of the perhaps bigger goal of developing some more of that technology to really be able to diagnose ovarian cancer earlier with more accuracy, can rely a lot on opportunities in teleradiology. MRI has been a big area of research, particularly with ovarian cancer diagnosis. It builds on math and technology to produce images. And so MRI has always relied on these things. Analyzing the images with artificial intelligence is currently an ongoing area of research to better standardize some of these procedures for diagnosing ovarian cancer, to be able to do so at earlier stages, and to be able to do so quickly and before other opportunities might be able to find that. So telehealth, of course, as we all know here, interacting with the Upper Midwest Telehealth Resource Center can be an excellent opportunity to help extend that access to care. So an important question with using artificial intelligence in any area of healthcare, why has artificial intelligence lagged behind Wall Street and Silicon Valley? So a lot of what we do in terms of finance and technology development, as well as utilization. So even if you have never had the opportunity to help develop any of the products, which I say with the recognition that many of us may never, we probably often wonder in curiosity, how does my device do that? And we may never know, but we can definitely assume that it relies on technology and often artificial intelligence. And so the reason why, or one of many reasons why artificial intelligence has lagged behind in healthcare, that we haven't been able to see as many of those kind of stunning breakthroughs and developments, is due to several reasons, largely regulation, which in this case, very good. We don't want our healthcare data to be as easily accessible as maybe some of the information that we share on social media. And so protecting that data has been a big reason why it's not as easy for code to flow through medical care. With Wall Street and Silicon Valley, they can scrape the internet for any data So in a technical sense, what that means is, much as the phrase maybe kind of implies with connotations, is that any data, so this can come from a variety of sources, both in terms of things that we maybe post or we share, and we can look at that and say, oh yes, I put this on the internet and I offered this out there, and that becomes a data point in a sense of it tells a story about who we are, what's important to us, what we value, and how we do it. But data can also come from a lot of other ways, from a technological side about what devices we're using and when. So there are all kinds of pieces of data available. Um, and so a lot of that data is not necessarily all that informative about who we are. And so there aren't very many regulations on it. So that data can flow very freely in other areas of research and development. That's not the case in healthcare because we do have very effective laws and systems that protect our data with that. So there's also problems with outdated IT infrastructure in healthcare. The physical equipment and hardware might not be up to the challenge of using some of these new methods with artificial intelligence, other areas of technology development. Also, we run into challenges and opportunities in that clinicians and administrators. So, all of you on this call have so much expertise with your respective areas. And what we really are looking to do as we move forward and look for more developments and breakthroughs is to really be able to bring together a lot of experts in a room so that you can impart all of your wisdom and experience and expertise alongside those who maybe have experience with computer programming or other technology development to bring that into the healthcare space, so that we can benefit, so that everyone can benefit from bringing together these vastly different knowledge sets, which each have a lot to offer, but don't necessarily always coincide well unless we take a very intentional effort to have conversations about how can we bring this together, how can we bridge some of these challenges, such as particular regulations with data, or certain technology capabilities limited by budgets in a healthcare space. Conversations like that can really help accelerate some of the developments that we've seen with Silicon Valley and Wall Street with similar technology to bring it into a healthcare space, to improve quality of life, and especially hopefully with ovarian cancer, because as we discussed at the beginning of this presentation, there are currently several gaps which technology could very much help address and move forward. In speaking about future directions of diagnosing ovarian cancer, there are many. So this piece of the presentation is a little bit more forward looking. So we've discussed some things that you can do today to help improve diagnosis of ovarian cancer and help raise awareness and move forward and shape some of the conversations for some of these future directions. And now I'll share some opportunities that currently are beginning that we can all watch, as well as stay in conversation with the stakeholders, and in your own organizations, you can consider how you can implement these and move these forward. So in general, when moving forward with artificial intelligence, of course, the first place to start is meeting with your current partners. And so for your particular roles, and within the topic of ovarian cancer, likely you already have excellent relationships with a variety of stakeholders, whether they're patients and families, or researchers, whoever may already be on your team in terms of trying to see improvements in this area. Continue meeting with them, and continue raising awareness about the opportunities to implement technological developments. And make sure that these conversations from the beginning are involving several stakeholders to bring together your various expertise and knowledge. And as you implement, getting feedback at every stage. And if you find yourself with the opportunity to work with people in your IT department or engineers or computer scientists at a research university, if there are opportunities for partnerships in those areas, you might keep in mind that there can sometimes be a tendency for developers to have the initial conversations and then be so excited to bring out the product that it turned out that it doesn't necessarily fit the initial vision and it might not align with the user in terms of accessibility. It might not serve the exact function. So making sure that these conversations happen regularly throughout the entire process can definitely be a very important piece of your budget for staying on target and within budget, as well as making sure that you're seeing the outcomes that you want with that. Specifically, there are clinical trials ongoing to use artificial intelligence with developing more effective MRI, as discussed, as well as developing either better, in a sense of more accurate blood tests to diagnose, or finding other biomarkers within blood that could be easily accessible, cost effective, or at least cost accessible in terms of deploying in our various communities, as well as thinking about communities that might have very different health infrastructures than the communities that we live in. So looking at opportunities with artificial intelligence in those areas often relies on doing large-scale literature reviews. Artificial intelligence can speed up that because for you or I, it might take a certain amount of time to read through the many papers that we would need to look at for a meta-analysis. The artificial intelligence can do it in a fraction of the time, which frees up our intelligence and capabilities to be able to move that forward and accelerate that with the knowledge that artificial intelligence can glean from that. Artificial intelligence also, of course, in the area of telehealth specifically, there are many opportunities looking at how we can integrate these conversations. So there's research looking at how healthcare providers maybe communicate differently over telehealth. So there's artificial intelligence research going on looking at communication methods to evaluate different metrics, such as how well is a patient comprehending the information that a provider is trying to offer, how well is the patient comprehending and complying with treatment plan. So there's many areas within that beyond just the technological development. Healthcare communication, as well as the receptivity to developing technology, are big areas of research. And so if you are using telehealth, hopefully you're also utilizing evaluation to look at how well that's going and whether you're meeting the metrics that you prioritize for your organization. Additionally, there are opportunities to improve quality of life for patients who have either been diagnosed with ovarian cancer or patients who are in the process of seeking a diagnosis, or rather in the sense of seeking answers to the symptoms that they're experiencing and trying to make sure that that's accurately diagnosed in a timely fashion. There are many opportunities to look at research that is trying to do this earlier. And so a large part of that is raising awareness, which all of us can contribute to by utilizing social media alongside our other channels of communication to help raise awareness and help patients to have the health literacy to know when they should seek out opportunities that are already available, as well as some of those opportunities that might be things they haven't heard about with clinical trials. So as you move forward this afternoon, I hope you take back with you recognizing that ovarian cancer has been difficult to diagnose historically. Artificial intelligence can be used to find what human eyes and previous instruments haven't been able to find. There are all kinds of opportunities with this, and it's heartening to be able to look at it in areas where there has been such a gap historically. And finally, there are opportunities to contribute to progress, whether you're a patient, a caregiver, a healthcare provider, a public health scientist or worker, or any other member of the public. There's all kinds of opportunities to be involved and work together for improving quality of life. So there were several references used today. And finally, hopefully you're already familiar with the Upper Midwest Telehealth Resource Center. Today was the first time that you joined us. We're so glad you're here. Hopefully hopefully you'll continue connecting with us and we can offer any information that you're looking for with telehealth. So thank you for coming this afternoon. And if you have any questions, I would be very glad to hopefully be able to answer them or at least have excellent conversation to hear about how this can be useful with your work.
Also, if you'd rather ask a question in live, I can let you unmute yourself and ask the question live instead of typing it into the Q&A. So far, I don't see any questions coming through on my end. All right, well, Jessica, we appreciate your presentation today. And I don't see any questions. So I believe that means you covered your topic and objectives perfectly. Thank you. Everybody have a great day.